Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board-certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us.
In this episode, you will hear a truncated replay from the practice management seminar that took place in November 2024.
And she's going to answer all of our questions about sunscreen, because if you guys are on social media, you're seeing all the crazy trends with people saying, no, use sunscreen, which is crazy. So we're going to learn now why we should still use sunscreen.
I'm not on social media, so
maybe that's
you might have to throw me your question.
That might be a good thing. So let's get a round of applause for Dr. Fu.
Thank you guys. Sorry I ran in here late. I was at a soccer game putting my sunscreen on the team. So I know most of you. I'm Teresa Fu. I'm one of the dermatologists at San Carlos. It's nice to see everyone dressed up, and thank you, Dr. Kamangar, for organizing. It's a little bit different than what you guys were talking about before, but we'd like to kick off our November Skin Health Month with a little bit about sunscreen and why it's important. So I have no disclosures. Here's a little overview. We'll go a little bit over about sunlight and skin. You guys know most of the basics. Sun protection, why it's important. We talk about this 50 times a day in clinic. And then I get a lot of questions personally from my patients who happen to be the well-educated. You know, they're all doing their own research about sunscreen safety. Lots of questions about, why are European sunscreens or Korean sunscreens better? So we'll try to answer a couple of those. We'll talk a little bit about the filters available in the EU and Asia, and then some of the controversies that people are bringing up to you in clinic. And then a little bit last about the role of iron oxides and antioxidants in skincare and sunscreens. We all know that sunlight's really important for human health. This is a picture I took from a hike. So lots and lots of benefits, makes you happy, like a day like today in general, but it also, as we know, it causes lots of problems. So skin cancers, which we're treating all day long, the signs of aging. Every patient asks you, how can I get rid of these wrinkles, right? So talk about that. So how do we protect our skin? We've got lots of ways to do it. You've got sunscreen and sunblock, and people will ask you the difference between those two. You've got sun protective clothing. That's like hats, long sleeves, pants, sunglasses, avoiding the midday sun, especially in the middle of the year, and then seeking out shade when you can. These seem pretty obvious, but a lot of patients will ask us questions about this. So let's talk a little bit about sunscreens. How are US sunscreens different from the rest of the world? Sunblock versus sunscreen, is there a difference there? We'll go a lot into the problem with UVA coverage with US sunscreens. Apparently the TikTok trend is all about Korean and Japanese sunscreen. Again, I'm not on TikTok, so I have no idea what they're talking about, but people bring the questions up. And then other ingredients are these important iron oxides, antioxidants, and then some of the controversies about sunscreen. So there's a lot of press about how sunscreens in the US are inferior, so not as good as the ones that we get in Europe. And that's actually because there's no new filters approved in the US since 1999. So it turns out we're about 25 years behind the rest of the world. And European and Asian sunscreens use newer and better filters, especially for UVA coverage. And that is because the FDA is regulating sunscreens as a drug. That's why if you look at your bottle of sunscreen, it has an active ingredient and the rest are down below, whereas in the rest of the world, they're considered cosmetics. So they have strict testing for safety and side effects. This is a good thing, right? We want safe products. Turns out the rest of the world also tests their products. They just don't have the same level of human testing. Actually, one fact that I learned when I was looking this up is that the EU bans animal testing, but the US requires animal testing to get that drug testing approval. So there's a conflict there. They're trying. In 2021, there was a new, I guess we'll say FDA regulation that put out, and they said, hey, we're studying the sunscreen ingredients, we're going to try to approve some new ones. Here's a list, levels 1, 2, and 3 of the ingredients and how safe they are. The ones considered safe are only zinc and titanium. That's the only one that they said has enough evidence to be considered safe. And they said everything else is under study, which, as we know, takes like years to get that information. So I don't think that anything new is going to be approved anytime soon. We were kind of hopeful when this came out, but it's been 4 years. So This is how I kind of split sunscreen versus sunblock when I talk to it about with my patients. So sunscreen, I tell them it screens out the sun. So you've got organic or chemical filters. These absorb the UV radiation and they turn it into heat. Actually, this is relevant for our rosacea patients. A lot of them will be like, oh, I'm using sunscreen all the time. But if they're using a chemical filter, sometimes that heat release will actually cause them to be a little bit redder. So I mentioned that. A lot of people think that the higher the SPF, the better. We'll go into that as well. That's usually with an organic filter. They're usually more cosmetically elegant. So a lot of men, actually most people like the cosmetically elegant nature. They're lighter, they're clear. Whereas sunblock, you've got the titanium or zinc filters. They absorb and reflect and scatter, which is why they're also whitening. Usually you cannot get above an SPF of 50, and they're often labeled for sensitive skin. There is no such thing as a waterproof or sweat-proof sunscreen. Everything needs reapplication, and that's supposed to be on the label too. So how much protection does your sunblock have? This is basically a graph showing you that it's not 100%. I'm going to go back to that. In the US, the SPF or sun protection factor is only rated for UVB, not for UVA. So an SPF 15 is 93% of UV rays, 30 is 96, and then 50 is 98. Even 100 SPF is really not 100%. There's really no 100% sunblock. So unfortunately, you're never going to get perfect protection here, right? It kind of levels off at this level. And then, remember we were talking about UVA. In the US, there is no UVA level. So we don't know how much protection a product has. It just says broad spectrum, so you know that's in there, but you don't know how much you're getting, right? That's in contrast to the EU, where there's a required 1:3 ratio for UVA and UVB coverage. So if a product is just, for math, 30 UVB coverage, it's a 10 for UVA. A lot of products are above that. And then for Asian sunscreens, which a lot of our patients are buying on Amazon, they'll look at the label and it'll say PA++, or 4 pluses. So the higher the number of pluses, the better the UVA coverage. So again, we're really behind the times here. They did a small study, I believe it was like a couple years ago. Somebody took the 20 best-selling US sunscreens and they put them to the UVA test for the EU and only 11 passed. So a lot of these were like the Neutrogena Beach Defense, the things that people buy and they're like, oh, it's SPF 100, but it's failing the test. So what do we have for UVA protection in the US? Actually, just 3 things. So we have avobenzone, which is the best long-wave UVA coverage that we have available here. It's extremely unstable, so you'll never see it by itself on the label. It's going to be stabilized with octocrylene or other ingredients. And then we have something called Ecanzol. This was really popular about, I want to say like 5 to 7 years ago. There was a product by La Roche-Posay. It was called Mexoryl. I haven't seen it on the shelves lately, so I don't know what happened to it. But it's still approved in the US only for this one specific line, so it's hard to find. And then you have zinc oxide, which is better than titanium in terms of blocking UVA. We have lots and lots of EU filters, but this is pretty much all we have in the US, which is kind of unfortunate, right? So this is a diagram showing you all the ingredients. I pulled this from a JAD article, which is really useful. You can see that in the US, this is what we have here. A lot of these are really old. No one sees PABA on the ingredients anymore. You do see a lot of avobenzone. You see a lot of this octinoxate, oxysalate, oxybenzone, octocrylene. These are all the ones that are approved in both the US and the EU. And then you can see over here in the EU, they have so many options, right? Mexoryl, SL, SO, SW. I didn't want to put the chemical names up here because they're unpronounceable. They have a new Mexoryl 400, which is extremely good at UVA coverage, but this is only in the European Union. And a lot of the Asian sunscreens use the same thing. I don't want to make it sound like the Asian sunscreens are behind the times. They're just using the same filters, right? It sounds like they're doing studies about, especially these two, the Mexoryl, Tinosorm S, Tinosorm M, and Mexoryl. You can get some of these in Canadian sunscreens as well. It's just unfortunate that we don't have access. And then I get a lot of questions like, hey, if I buy this European product on Amazon, is it legit? And the answer is we don't know, right? Because a lot of them are third-party sellers. You don't know if they're counterfeit. So usually a lot of my patients are traveling or they have family abroad and they just bring back sunscreen. That's how I get mine too, is I have friends bring it back to me. A little note about visible light protection. We get a lot of questions, at least I do, about melasma and sunspots, lenticos. It turns out there's a lot more evidence showing that visible light, like this stuff here, computer screens, is also important for pigmentation. So you can't just put on your regular sunscreen and get protection. You actually need to have a little bit of blockage of this stuff too. So lots of pigmentary disorders, melasma, freckles, PIH, photosensitivity disorders like lupus, PMLE, they respond to just like the regular light that surrounds us. Turns out that's because visible light creates free radicals, leads to inflammation and melanogenesis, which is darkening. So a lot of us are now recommending iron oxide or tinted sunscreens that have a little bit of block. They look like foundation, so it's hard for men to wear these. I think there are people working on filters for this as well. And then the newest thing is, I'm sure you've seen a lot of products, they all say I buy antioxidants in the sunscreen, vitamins E, vitamin C, lots of research being done on which is helpful, but these block those free radicals that we were talking about that also cause cell damage. Sorry about that. So sunscreen concerns, a lot of people are on social media, the internet, talking about how sunscreen is toxic for you, and the coral, we'll talk about that too. They're like, it doesn't work anyway, use coconut oil, right? So far, I tell my patients there's really no evidence that these cause cancer, sunscreens cause cancer. They are very, very helpful. They're effective in protecting against sunburn. People are like, well, there's no evidence that reduces skin cancer. That's not true. So there are studies that, especially out of Australia, where it reduces incidence of actinic keratoses. It drops your risk of SCC by 50% if you use it correctly. There was a small study that reduced risk of melanoma. There's actually a lot of nuance to this. We can talk about that if people have questions, but it still reduces your risk. It's not 100%. And then there's a study in Australia that showed over 3 years, if you're really good about sun protection, actually reduce your number of moles that you developed. This is for kids. A lot of questions about absorption of chemical sunscreens. This is true. You actually do absorb your chemical sunscreen. So if you put it on correctly, which we'll go over their amounts, you will absorb some of the chemicals. So you also absorb the chemicals that are in those coffee cups that everyone's drinking, right? So there is absorption about 1 to 2% from application. Turns out that most of us have oxybenzone, which is one of the chemical filters in our system. It shows up in your urine, it shows up in your blood. It's a little scary, right? With lots of other chemicals that we do. Civil absorption, they've done studies for avobenzone, ecanzole, octocrylene. And so this got a lot of press about 3 to 4 years ago. And then people will link this to chemical studies done on cells or in animals where they've linked oxybenzone to breast cancer, which causes hormonal effects. But you have to remember the doses for animals are huge, right? 100 or 1,500 milligrams per kilo per day. No one's ever going to get that amount applying topically. It's still of some concern for some people, and so they've done studies where they had you absorb the chemical, and then they tried to measure your hormones like estrogen, testosterone. They really haven't shown a direct causative effect. So the FDA says these are really safe to use. There's no current evidence linking it. In fact, most of the time, the problem with sunscreen is allergic reactions. Dr. Mullen will know this. Oxybenzone will sometimes show up on patch testing, but in the couple studies I was looking at, it's actually more common to react to the fragrance in the sunscreen that they were using. So overall, safe to use, do not currently have evidence of human harm. If you're really worried about it, maybe use a physical blocker. Lots of more studies are coming. Right? A few years ago, there were questions about whether micronized ink, which is like the tiny little particles that aren't so whitening, are those getting into the system? Are we getting ourselves heavy metal poisoning? And the answer is no. So they've done lots of studies where the particles do not get into the skin. They basically just stay on top of the skin, unless you put it on broken skin. But most people aren't doing that. So they stay in the stratum corneum. There's really no systemic absorption. That's kind of put to bed. I get a lot of questions about sunscreen and vitamin D. My patients will be like, well, I don't want to put my sunscreen on. I need my vitamin D. I'm deficient. It is true that vitamin D is made in the skin. It's stimulated by UVB. So that's the one that causes sunburn. It's the same one that's blocked by SPF. It is really important. We all know this. The truth is that if you're really using really good sun protection, SPF 50 all the time, your vitamin D levels may go down. Most of my patients aren't actually using enough sunscreen to cause this, right? They're not reapplying it. They're not covering all the body. You can check levels. Insurance coverage is another issue about checking levels, but you can check them, and then I usually recommend a vitamin D supplement, about 1,000 units a day if they're worried. I get this question a lot too. So are sunscreens causing FFA? So for those of you who don't know, FFA is frontal fibrosing alopecia. It's a scarring alopecia that causes, basically you lose a hairline here, and it can go backwards. I was taught it was rare. It's not rare. I see at least once a day, but there's some link on the internet and some questions in the literature of whether sunscreen particles like titanium are underlying this rise in FFA. Are they being absorbed into the follicle, causing inflammation and causing the immune system to attack the hair? So there have been a couple small studies. The evidence is decidedly mixed. They actually tried to link it, and maybe the question, the authors are usually saying, the question is actually, is it the other chemicals, is it the fragrances causing the reaction instead of the titanium? So people have actually put titanium into hair follicles to try to see, and nothing has happened so far. So they're trying to look at the evidence. There's no clear link. If you're really worried, I tell people not to put your sunscreen all the way into your hairline, right? And then we've all been to Hawaii, or hopefully you've been to Hawaii, right? Some areas of the world ban certain chemical sunscreens. It says reef safe, so they're not allowed to have oxybenzone. And this is coming from a few studies in the late 90s and 2000s showing high levels of oxybenzone near areas of bleached coral, which is very sad, right? We don't want chemicals to affect the coral. But again, if you look closely at the evidence, those are really small studies, and the methodologies are a little questionable. It turns out that it might be a mix of global warming. Warmer waters would stress the coral, and then you put any chemical near the stressed coral, and they will actually bleach or die off. So we're not sure there's a direct link between the oxybenzone and coral death, which is good to know. And then it does turn out that the zinc and titanium sunscreens, those particles, when they go into the water, they actually just drift down to the seafloor. They don't really cause any problems. So proper use of sunscreen, we all know this, but our patients probably don't. For the chemical sunscreens especially, you have to really put it on before you go outside. It takes about 20 minutes to set. The zinc and titanium ones really sit on top of your skin, so they're almost ready to go. You have to apply enough, so to get that SPF number, this is the amount you have to use, which is 2 milligrams per centimeter squared. That turns out to be at about a teaspoon per face, 1 to 2 per arm, 1 to 2 teaspoons for the chest and back individually, and then same for the leg. So that's a lot. For a full body, if you're in a swimsuit, you really need a shot glass full. And most patients are using about half to a quarter of this, especially on the face. So if they tell you they got their sunscreen in their car and it's lasted a year, you probably know they're putting on like a little pea-sized. And then you have to reapply it, which is so sad. It's after 2 hours, the effect is gone, and it's even less if it's like you're sweating or swimming or toweling it off. So there's lots of downsides to sunscreen, right? You have to buy lots of bottles of it. I go through about 10 per summer with my 2 kids. Cost can be an issue. If you're buying the expensive ones, you have to reapply it. It's messy, it gets all over the place, it's whitening. And then in the US, unfortunately, we're still missing that really important UVA protection. So I tell my patients, if you ever see me out in town, like I'm usually covered up with sun protective clothing. I usually buy the cheap drugstore ones for the body, and then if I'm very cosmetically sensitive or whatever, I'll use the EU sunscreens for the face, neck, and chest, save the money for the important areas, and then apply enough. So you really have to put on quite a bit. You'll go through a bottle pretty quickly, apply every morning, and then I apply again if I'm going outside for lunch, and then after work, especially in the summer if I go for a walk. And you don't forget your sunglasses and lip balm. If they're concerned about the chemicals, I usually tell my patients just to avoid the sprays because most of them have propellants as well as chemical sunscreen ingredients, and then to look for the physical blockers and to really spend the money on the UPF clothing. There's also stick sunscreens. They're really expensive, and then wash into clothing ones, although this is not very popular. It's not very good for the clothing. So, you guys all know this, sun protective clothing. It's labeled UPF. A lot of retailers cover them. It used to be just Coolabar and Sunday afternoons. Now lots of options. Athleta has them, Lulu, all the athleisure things. There's lots of cute stuff out there, right? And the big hat, sunglasses, and then long sleeve and pants. So just a little summary. We all know this, UV radiation, causes skin damage, skin cancer, signs of aging that we don't like. So it's really important to protect the skin from that UV radiation as well as visible light. We're still working on sunscreen ingredients in the US. Hopefully the FDA will get its act together. Do think about UVA protection, especially for patients with skin of color, patients with pigmentation disorders. But in general, sunscreens are really considered safe, right? And to use enough, and then look for these antioxidants and iron oxide containing ones for new products. Thank you very much.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below, and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.